We'll start. Hi, everyone. My name is Mel. I am a member of Outdoor Women's Wellness, a provider, I should say. And I am here today with Missy, who is going to talk with me about some kind of, I would say, pretty sensitive topics and how she worked through some things and used her yoga practice to start to take over her own, I guess, journey. So very nice to meet you, Missy.
Yeah, it's so nice to meet you too, Mal. I'm so happy to be here today. So thanks for having me.
Yeah.
Like you said, I am a yoga teacher. I don't actively teach on the regular now. I teach about once a month with a community group with where I'm located here in Charlotte, North Carolina. I can just dive into my vaginismus story if that
Sure.
sounds good to you. All right. So I'm about 36 now, and I started noticing, pain, down there actually like pretty young, probably around like 16, 17 years old. I remember when I first started using tampons, they were never super comfortable. I could still insert them, but it wasn't really it wasn't very comfortable in the insertion process. Sex was never really comfortable. And when I was younger, I just thought that's what it was supposed to be like. I just thought
Oh,
it was supposed to be painful. And then it just never went away. um, and it wasn't really until it was just something that kind of like grin and bared it until I was about 30. In my younger 30s, I finally expressed to a healthcare practitioner, my gynecologist, that hey, some things are kind of painful down there, and I don't think that's normal. And so she was great. She referred me to a physical therapist here in Charlotte, and I started working with her. Um, let's
would
see.
you say that you were surprised that it sounds like for a while it took a little bit of time for you to ask a practitioner, hey, like this is going on, is this normal? Do you feel like you were surprised that they had an answer right away?
Yes and no. I had done a fair share of Googling by that point, and it was something that it just kind of took the courage to actually like say the words out loud, like, hey, I think I have a problem here.
Yeah.
And to dive a little bit deeper, like you said, into more sensitive topics, like, I also kind of ignored it and suppressed it for a really long time. I didn't have sober sex for like almost
Sure.
10 years because it just hurt.
Right.
And so there were a lot of things that I just kind of did to like ignore the issue. But then, I was going through therapy and all this stuff, and all these other issues started coming up, and it was like, oh,
Sure.
it's probably time that I start taking care of this because it is something that's impacting my life in a pretty big way. So.
Absolutely. I can totally um, see where it would be uncomfortable to bring up to a practitioner, and also
Mhm.
where you feel like you're not, woman enough, or like you're not doing something right, or, it's you blame
Mhm.
yourself for it. And I hear that a lot from my patients and my clients. So yeah, I can totally see where it would be hard to just, talk about it. So yeah,
Mhm.
thank you so much for sharing.
Yeah, yeah, of course.
So what about physical therapy would you say was helpful for you? And I know therapy is different for everyone. So
Yeah, I think first and foremost, the practitioner that I saw here in Charlotte, North Carolina, her name is she's Dr. Kelly from Elite Physical Therapy, and she is just like has the most wonderful presence. And so I felt really comfortable just being open with her about what I was struggling with, and I think first and foremost, just being able to like talk to someone about it, which was something that I really hadn't done before,
sure.
was amazing. I think when I think about the physical things that we did, um, having her be able to kind of be a mirror, especially with like internal examinations and internal massage, was so helpful because I had done so much suppressing that I kind of think that I had almost like um, what's the word I'm looking for? Disassociated almost
Yeah.
with my
Yeah.
pelvic area. And so even though like I've been doing yoga for almost 15, maybe even almost 20 years at this point, I grew up being a dancer. Like in so
Sure.
many ways, I'm a very body aware person. And there are just sections of my body that I realized that I just ignored, and I didn't have like a lot of control over or a great relationship with. And so to
Sure.
be able to have a safe space where someone could tell me like, oh, there's a trigger point here, or you're tense here, and to be able to work with me and give me that feedback to help me like breathe through it and loosen up was
Yeah,
incredibly helpful.
that's awesome. I just
Mhm.
imagine when you said like dissociated or like just sensor blocks, like black
Mhm.
black boxes over certain spots.
Yeah.
It is so interesting to me that you are a dancer, because I feel that so much of what you do as a dancer is like lifting yourself, like looking like you're light as air. And I know that you're engaging a lot of muscles to do that. So I can imagine that that maybe has a correlation. I'd love to find some research about that.
Yeah.
Yeah.
Mhm.
Wow. So when you were working with your physical therapist, I'm so glad that you found a good one, because I know that it can be so helpful to just have someone on your team. Did you start to once you were aware of the things that you needed to work on, and once like did you ever work with the dilators at home, or did you do any like manual stuff on your own?
Yeah, I have one dilator, and then I did manual things on my own as well. But I'll be honest, like my practice with that totally fell off.
Yeah. Yeah.
I was really good at the homework she gave me that was like exercises, because a
Hmm.
lot of them were things I was really accustomed to doing, or really similar to like what I would teach in the yoga class, or um, I also teach yoga that's like more similar to group fitness. And so I was like, the things that I easily like vibed with or were kind of already doing that like fit naturally into my schedule and my habits were super easy for me to pick up.
Sure.
But it was more like making time to really take care of myself and to like go inward and to do like the self massage or the self trigger point treatments, or using dilators. That's still something that like I'm honestly still struggling with and
Sure. Sure.
just now getting back into.
Nice. Good
Mhm.
for you. I know, I feel that a lot of the women I work with who I've suggested dilators, they'll buy them and maybe they'll try them once or twice, or they'll say, "Oh, I have them. I haven't opened them yet." So I think there is this sort of, not necessarily a taboo, but maybe just like this little bit of a hesitation where I you can make yourself very comfortable, light a candle, take a hot bath, like make like try and like calm down your whole system. But
Mhm.
then when it comes to it, it's like, well, I'm sure that it's hard to bridge the gap between exercise and then like the true like actually having sex,
Yeah.
and it's so different. It's so different than just like doing an exercise. If you go and do a core workout versus if you're like, well, I'm going to go do my exercise, and then you lock yourself in your room, and so I think it is hard for people to bridge that gap, to take it home.
Mhm.
And I wonder how I as a practitioner can help people over that gap. But
Mhm.
yeah, no, I would you say that the hands-on, the manual stuff was ultimately what had you going back to physical therapy?
Yeah,
Yeah,
it
yeah.
was that, and just having her as an accountability partner was also
Yes.
like, because I'm a good student, if you will. Like I will do my homework. I mean, I just said that I kind of struggled with some of the more manual exercises, not
Sure.
myself, dilator work, but I was much more motivated to at least do it like once in between sessions. And I was going about once every week or once every 2 weeks.
Yeah, I would say
Um,
that's pretty
and
common.
so it was a lot easier for me to be held accountable. Like, oh gosh, I'm
Yes.
here tomorrow. I have to do at least one thing.
Yeah.
And so when I stopped seeing her pre-pandemic,
Okay.
for reasons that I didn't share here, but I'm happy to,
Sure.
I realized I had some like more childhood trauma that I had to go through. I had kind of, I know a few of the other women that I've connected with who have vaginismus, like there is a trauma component to their
Yeah.
experience. My trauma is like a little different. I've never met anyone else with this experience, which I guess is why I feel called to share it right now in case someone else is out there
Sure.
like
Sure.
need to hear this, like that they're not alone. But I like just mysteriously stopped growing when I was about 9 or 10. And so from the ages from like 9 to 15, I went through all kinds of tests and stuff. Like they tested me for growth hormone and like all these other things. And I just kind of felt like I was this like little medical guinea pig
I
for
can,
in some like primary developmental years. So I was
yeah,
in some pretty like intimate, sessions and like not necessarily treatments, but like testing and exams and everything were done. And I was still a little girl. And
right.
so I just remember like when I was in high school, my girlfriends getting nervous for like their first gynecological exam. And I was just like, whatever, like been there, done that, which is not a great thing for like a 16-year-old to
Right.
say. And so I stopped my PT because I realized like, I think I plateaued, and I think it's because I had definitely made some physical progress. Like I started to feel more sensation down there, which was really exciting and fun for me. But I still had situational vaginismus. And I was like, you know what, I think I need to start seeing a psychologist.
Sure.
I need to dig into this from like therapy
Yeah.
and counseling perspective. So that's why I originally kind of tapered off with my physical therapy. And then the pandemic hit.
Yeah. Oh, and we've all been affected by that for sure. Well,
Yeah, yeah.
thank you for sharing that. That's such an interesting, yeah, I don't know if I've ever heard of anyone just stop. Wow.
Yeah, yeah.
And I definitely, in regards to trauma and vaginismus, I totally think there's a huge correlation. I don't think that you have to have any, past trauma to experience this, but I do think that a lot of the people that I work with, especially over, the course of 3 to 6 months, like we've been doing everything physically, like tissue changes in, between 2 weeks to 6 to 8 weeks, like your tissue changes, your body changes what it's doing. But if the signals coming to your tissues are not as conductive as they could be, as helpful as they could be, then I can certainly see where having another person in your team to work through some of those things would be super helpful. Because I see people kind of plateau. Like you said, situational vaginismus.
Yep.
Like you might have no issues with your tampons anymore, or, like you might have less pain, or, but in a certain moment you might experience more. So yeah,
Mhm.
that's interesting.
Yeah, and one of the kind of things that sparked me to get back into it was actually just that. I was like so excited because I had never used a menstrual cup before, and I had been meaning to try a menstrual cup for like years. And I was like, oh gosh, like, and I bought one, and I just like never, took it out of the box. And so a couple of months ago, I was like, I'm gonna do it. Like, I'm gonna do the menstrual cup, and I got it all prepared. And Mal, like, I barely got it in, and then when it
Oh,
was time to pull it out, like, I mean, I was on the website, like, and they have tutorials on like,
yeah.
breathing and relaxation exercises in case you feel like it's not coming out naturally. But after that, I was like, holy moly, I got to get this taken care of, because that was like that was a pretty traumatic
Yeah.
experience,
Yeah.
like trying to remove the cup. So
I have yet to try the cups, and I want to so bad. Like I love being as zero waste as possible. And I'm not sponsored, but thanks, those underperiod underwear, they're awesome. I love them so much. But the cups, yeah, that's definitely a step up, I would say. But good for you for trying. That's awesome. Good for you. You've inspired me. I should probably go get one.
yeah.
Yeah. So I wondered too, we met actually on Reddit. There's a wonderful Reddit group that is our Vaginismus, and I feel like there's so many people who share their stories there, and success stories, and just, seeking help and advice. And I was scrolling and I saw your post, and I believe that your big question was, um, can I pick your brain? What sorts of things would be good and specific to yoga, right? Like that you were like, well, I'm developing my own program. What should
Mhm.
we do? So I'm curious what you have so far. Like, what would you say you include in your practice?
Yeah, so I'm still in the midst of developing what that looks like, but I have started kind of formulating things into three buckets. And these are based on just a lot of research I've done in my own time. I follow, like, are you familiar with Isa Herrera? She's a physical therapist who's suffered. I think she's had like a slew of pelvic floor issues, and essentially like worked to heal herself. And so she teaches some online courses that I did engage in earlier this year. But again, I haven't made any changes because I need those accountability partners. But it was a really, really informative online program that I do recommend to people if they're interested in taking a deeper dive to learn more about like anatomically, like what's going on.
Yeah.
And so through some of the exercises that she recommended through her program, in addition to just kind of things that I know through my yoga teacher training, I sort of developed 3 different buckets. The first I've called relax and release, because I know, some women think like vaginismus, oh, like Kegels. Like I think there's this like common cultural perception that Kegels are the answer to everything.
The amount of
There.
PTs that don't have training in pelvic floor PT and just give out Kegels, I just,
Yeah.
oh,
And I think that my doctor maybe even recommended that to me before, like as she was also sending me to the PT. So, and what I realized in the like Issa's, online course, and she also has some books. Um, that's not a great thing for some people to do. Like the tightness is not the problem. We
right.
don't need to do that anymore. We need to relax. And so I think there are some really great stretching exercises. Yin yoga, if folks aren't familiar with that, yin yoga is a practice of, longer holds, kind of focusing more on relaxing the fascia rather than really stretching the muscles. But that can be really beneficial to women with vaginismus who need to focus more on relaxation, in addition to, creating meditative exercises. And so that's kind of the first bucket. The second bucket, I think, is this concept of developing core strength without going too crazy. I know a lot of women who maybe are more drawn to like power yoga. Or like more intense exercises, like maybe that's not what we need to do to teach our pelvic floors to relax, but we still want to work on strengthening our core. And so what are some maybe more belly up exercises or grounded exercises that can be done to still help strengthen the core without really overactivating the pelvic floor muscles?
I love it.
And then
Okay.
the bucket that I'm working on is a little more focused on pelvic floor activation and working on kind of pulling the pelvic floor up and in a really mindful way, and just a little more activity for those who are, kind of in that last phase of like, yes, I'm ready to strengthen. Like I know how to relax now. Let's like kick it into gear.
I love it. No, that is fabulous. That sounds very similar to my process with therapy and their home program, and that's wonderful. I love it. It sounds so good.
Mhm.
Awesome.
Yeah.
So let's see. I think we covered all of our questions. Do you have any other thoughts right now? Anything else you'd like to share? Questions for me?
Yeah, I would love to hear a little bit more about like themes that you see across the women that you treat, and different. I mean, of course, like every treatment needs to be customized
Yeah.
to whatever the woman has going on. But I'm just kind of curious to know like what are some common themes that you see?
Sure. So you had mentioned earlier trigger points, and if people don't know what a trigger point is, so you can probably find one right now. If you grab your upper trap and you start to dig around in there, you'll find a knot. And if you release those knots, then you feel better, hopefully. So I actually have done a course. I'm certified in dry needling. So I will dry needle people's trigger points, not necessarily in their pelvic floor yet. I'm going to have to go for a couple more courses because that's very sensitive stuff down there. But I have been needling people's glutes, because if your pelvic floor is really tight, your glutes are probably really tight as well. I have needled people's abdominal muscles, which is a little bit wild. That actually, for me, brought up a lot of emotion. And when we were working on that during the course, I told my instructor that. He goes, very common. So I think people tend to hold, if you hold stress in your shoulders, if you have vaginismus, you might be holding stress truly in your pelvic floor, in your stomach. You're not allowing yourself to breathe. So I think that has been a really, I guess, interesting and new piece of the puzzle that I've been trying to help people with. And of course, I do a ton of work with breathing. I teach people how to do their belly breathing, making sure that they're really incorporating their whole body into that breath, without having effort with the breath. And then I do a ton of education. Like you said, I feel like it's so important that people understand their body and are aware that, oh my gosh, you have like 15 muscles down here that you need to work on. And I think it's just so nice to know what a normally functioning pelvic floor moves like and feels like and acts like, because I always say that if you don't have any problems, you don't think about your pelvic floor, but if you are having a problem, that's probably all you think about. So my goal is always just to help people find it and then forget about it and just let it do what it needs to do. So usually that's when I try to help transition people to just a home program, or maybe I'll see them instead of every week or every other week, I'll see them, every month, or, I call them and check in. With our virtual services, of course, I can't do as much of the hands-on stuff, but I think, like you said, it's just really important that you have someone there to talk to you about what's working, what's not working, questions that you have, things that you might have found. I learn something from my patients every day. So I love just having that open flowing conversation to help people along. And then you had mentioned, what do I notice across the spectrum? Like I said, really tight or active abdominal muscles, oftentimes really tight or active glutes. I have people do a ton of stretching, cats and cows, child's pose with a side bend and breathing, or happy baby to really open up their hips. I always try to make sure that yoga poses are, they have a soft awareness of the pelvic floor. So I want you to make sure that you're not holding your breath. I want you to make sure that you're not straining to achieve the position. Just because I can get into a certain position, or the person in the picture on your home exercise program can get into a certain position, doesn't mean that your body is meant for that. So I try to give people an outline of an idea of what they should feel and what they should look like when they're working on a stretch. I would say that a lot of my gals with vaginismus have pretty poor body awareness around their pelvis. Once I poke a muscle and they're like, oh, that's really tender. Or I find that women are really ticklish when their muscles are that, irritated or sensitive. I'll be assessing their hip bones and seeing if they have good alignment in their hips, and they'll be giggling away at it. And whether that's a nervous giggle or like it truly does tickle, I always interpret that as their whole system is like way sensitive to this. So I would say that's pretty common as well. But it's such an individualized concern for people, and I always just try to make sure that they get to tell me their story, and then make sure that we talk about what they want out of their treatment. So I guess anecdotally, I worked with a younger girl who was a soccer player. She's really good, and all she wanted to do was wear a tampon. That's all she wanted. And we worked really hard. We talked about breathing. We talked about different positions. We talked about the squatty potty, if you've ever heard of that, like just ways to help her sort of have a routine around using a tampon and making sure that it was going to be comfortable so she could focus on her game. So I remember she actually just stopped coming one day, and I called her like a few weeks later, and I was like, hey, how's it going? Do you need any more help from me? And she goes, oh no, I got it. And classic teenager, like, I'm done with you, that's fine. So I told her I was super proud of her and happy life and move on. But it's always exciting to have success stories. And it doesn't always have to be about having pain-free sex. So I think sometimes, especially like in the LGBTQ population, or, someone who might be pansexual, or who knows, like someone who doesn't necessarily need to have or want to have penetrative sex, like you can still have functional limitations from this. So the more people we reach, the better.
Yes, I love it. And I think it's so important to have these like open conversations.
Absolutely. Yeah. Well, awesome. It was really nice to talk to you. I'm so glad that we linked up. And if you are ever interested, I would love to see those buckets more developed, and maybe you could jump on for some tutorials. That would be so cool. Yeah.
I love that so much. It's also a good motivation to get my booty in gear and get so I need accountability partners in all areas of my life. So
We definitely have that in common. Well,
yeah.
thank you so much, Missy. It was great talking with you. If you want more information about vaginismus or your pelvic floor in general or postpartum care, then you can check out Outdoor Women's Wellness, and we would love to chat with you.